What is going on YouTube? Landon here, and today we are diving deep into the duties of a phlebotomist. If you're interested in this career, then you picked the perfect place to learn the roles and responsibilities. Right off the bat, as a phlebotomist, you'll be doing much more than just drawing blood. So, you ready? Let's get right into it. If you're new to the channel and want to start your dream career faster without student debt and spending years in the classroom, then make sure that you subscribe to this channel, because here we share tips and tricks to help you do just that. All right, you ready? Because I'm about to start now. So, the big question, what do phlebotomists do? Number one, drawing blood. I know it seems obvious, but as a phlebotomist, your primary role is drawing blood. All right, so I don't care what anybody says, phlebotomists are the unsung heroes of healthcare. When a doctor or physician orders a blood test, that's where you would come in. Phlebotomists, also known as phlebotomy technicians, are skilled healthcare professionals who specialize in drawing blood from patients. This is usually done by performing a venipuncture, but other techniques can also be used to draw blood, like a finger prick. Your work is crucial in aiding doctors with accurate diagnosis, monitoring health conditions, and even saving lives through blood donations and transfusions. So yeah, you're a pretty big deal. By the way, if you've decided to become a phlebotomist and want to start your career faster without spending thousands of dollars on your education and training, then you need to check out this video by Grant. He gives you a step-by-step blueprint on how to become a phlebotomist in as little as 2 months. 2 months. How to get a university certificate without student debt, and how to get clinical experience before you get your first job. I mean, that is amazing. And guess what? I will link the video down below. All right, so moving on. Number 2, patient identification and preparation. Whenever a patient visits a bustling hospital, a clinic, or a diagnostic laboratory, they are greeted by the beautiful, friendly faces of a phlebotomist, aka you. You'll begin by verifying patient information, preparing the necessary equipment, and selecting the appropriate method for drawing blood. You have to explain the procedure to the patient, address any concerns, and ensure the patient is comfortable and adequately prepared for the blood draw. While interacting with patients, let those people skills shine bright like a diamond. It is not rare for patients to get nervous. Some might even have a fear of needles, like me. Your job is to make them feel at ease and ensure the entire process of drawing blood is smooth and comfortable. You got this. Number 3, safety and infection control. Safety is a top priority for phlebotomists. You must follow all the safety protocols to minimize the risk of infection for both yourself and the patients, because we don't want nobody to get sick. This includes wearing personal protective equipment, disposing of used needles properly, and maintaining a clean and sterile environment. You're also responsible for quality control. This involves paying close attention to the collection process, ensuring that the appropriate amount of blood is drawn and the samples are suitable for testing. Number 4, labeling and recording specimens. After collecting blood, a phlebotomist must label the specimens accurately with patient information and other essential details. So get those pens ready. Now, if you're confused, a specimen is just a fancy word for a sample. Apart from labeling, you must also record the procedures in the patient's medical records for documentation purposes. Sometimes in a diagnostic facility, a patient might have to undergo different tests like an EKG or an ultrasound. So when a patient visits your station to draw blood, you have to make sure their medical record is updated. Number 5, transporting specimens. Now that you have safely secured the product, aka the blood sample, and updated the medical record, you are also responsible for properly handling and transporting blood specimens to the laboratory for testing. Phlebotomists must ensure that the samples reach the lab in a timely and secure manner, maintaining the integrity of the specimens. Kind of like a Bond movie. Like if James Bond was a phlebotomist. Number 6, maintaining the equipment. As a phlebotomist, you have your own equipment, which usually includes needles, tubes, syringes, and lancets. You have to regularly inspect them, make sure everything is working fine and safety standards are being met, because you don't want to get in trouble. But if there are any problems or if something is malfunctioning, report it to management. In some facilities, you're also required to keep track of inventory. Number 7, clerical duties and being a part of a team. As I said, updating a patient's medical record could come under your purview. Apart from that, there might be additional clerical duties like scheduling appointments and organizing paperwork related to the blood collection process. Phlebotomists work in close collaboration with other healthcare professionals, including nurses, doctors, medical assistants, and laboratory technicians. I mean, y'all are the super team. And a part of this super team, you are responsible for making sure everything is running smoothly. And you might be asked to take on additional administrative or clerical responsibilities, like a blood collecting Nick Fury. So there you have it. These are the top duties of a phlebotomy technician. Now, if you are passionate about helping others and want to start your career as a phlebotomist, I personally recommend checking out the video linked down below because it is good. In this video, Grant reveals how you can get the right training without paying a big price tag or driving to classes multiple times a week. You'll also learn about the number one thing that employers look for when they hire a phlebotomist, how to ensure that you meet the criterion and get job ready as a phlebotomist in the next 3 to 4 months. I mean, Grant gonna get you right. So go ahead, click that link down below, and I hope today's video was valuable and that you liked it. Make sure that you smash that like button because it really helps us to continue bringing you all content and keep you informed. If you have any questions, drop a comment down below and we'll make sure you get an answer. I mean, I'll make sure personally. This is Landon, signing off. Take care.